be aware of what is going through our minds, and of course how we feel and how we behave. These three things also will determine our state of mental health. A number of things will actually contribute to deterioration of our mental health. But first and foremost, I want to use our life experiences as a general cause of the deterioration of our mental health. What do I mean? You could be going through a difficult work experience, and this would include either being declared redundant, or being laid off, or loss of income as a result of pay cut. That in itself is a very negative experience, life experience. The other cause for our mental health deterioration, of course, in the context of our life experience, are losses. Okay, when you go through a loss, it could be a loss of a loved one, and this is as a result of death. It could be a loss of a relationship. It could, this could be marriage. It could be just a relationship. That in itself can really constrain your emotions, and as a result, therefore, deteriorate your mental health. Loss of status, okay, loss of property. And general aspect to do with loss. And therefore, when you go through a very difficult life experience, it's highly likely that you're going to suffer a mental retardation, and this will impact your mental health, and therefore contributing to the deterioration of your mental health. A number of things to watch, and just being aware. Lack of interest. All of a sudden, you lose interest in things that you used to enjoy doing. For example, if you're a sports person, you enjoyed going to watch football, you enjoyed going to watch rugby, or just go to the stadiums and enjoy sport. And all of a sudden, you lack interest of whatever you used to enjoy. Number two, you also may lose sleep, what we call insomnia. Okay. Ideally, when you're functioning mentally well, when you go to bed, between 15 to 20, 30 minutes at most, you're supposed to be asleep. But here is a person who you go to bed, it's 1 hour down the line, it's 2 hours, it's 3 hours, there's no sleep. And as such people in the morning, you'll hear them telling you that I am so exhausted. And yet you expect that in the morning you should be very fresh, you should be very motivated. So this is a result of lack of sleep. That should also indicate that this person is struggling mentally. Change of appetite. There are those who will either eat so much, or there are those who will actually lack appetite completely. Okay, that should also worry that perhaps there's something happening with your mental health that needs an attention. Social withdrawal is another sign that things may not be working well with you, because then all of a sudden you withdraw yourself from people and you prefer being alone most of the time. When you go through social withdrawal, therefore, then we can safely say that you could be struggling with mental health. As I'm talking about this symptom, I just want to remind our viewers that this is not just a one-off. You don't just lack appetite today and we say that you're actually depressed or you're struggling with your mental health. These signs and symptoms have to be persistent for a period of time, at least 2 weeks and beyond, for us to be able to say that it's a worrying point, it's a worrying period for anyone going through these symptoms that I'm mentioning, and therefore this person may require attention, may require support. Of course, I'm talking about where also one just decides to just lack he doesn't pay attention to themselves. This is also another sign. Hopelessness, sadness, extreme sadness, because then depression is just characterized by extreme sadness. Sometimes it could be cautious, sometimes it could be unconscious. Sometimes one would know what is causing them to be actually sad, but others may not really realize what is causing the sadness. And therefore, when you experience this plus many other signs, then it will be important to actually take that step to get support and to come out of this whole situation of depression. Depression is a mood disorder characterized by extreme, persistent feeling of sadness. And when we say that depression is one of the leading causes of suicide, it is true, because then when you're depressed, you're sad. When you're sad, you're hopeless. People who die of suicide, many times they have lost hope. And therefore, in depression, you lose hope because then of the sadness, because of the bad experience that you have gone through. And that is what explains why people with depression are more likely to die of suicide than those who are not suffering from depression. So how can one test for depression? From the counseling perspective, we do what we call psychological assessments. Okay? And these assessments are aimed at establishing the symptoms that I've talked about earlier and be able to establish whether these symptoms have been there for a period of time. So there are a number of assessments that we psychologists use. A good one is the Aaron Beck Depression Assessment Tool that clearly would indicate whether you are suffering from depression or not. And of course, it also tells the levels of depression, because there is mild depression, there is severe depression, and there's of course extreme depression. So these assessment tools will help us be able to identify whether this person is depressed and to what level is this person depressed. But also through psychotherapy, the counseling that we go through with our clients, we can easily be able to help them identify whether they are depressed or not. But from where I sit, I think I always prefer doing a psychological assessment to be able to ascertain whether this client is going through depression or not. Of course, under the psychological assessment, just to mention that we have what we call a DSM, Diagnostic Statistical Manual. Now it's at DSM-5. This is a key tool that we use as mental health practitioners to be able to diagnose for depression and other mental related disorders. I did mention earlier, but just to emphasize that, of course, extreme sadness, lack of interest, hopelessness, social withdrawal are some of the key major signs that someone could be going through depression. Sadness, extreme sadness, sometimes unexplained extreme sadness will clearly be a sign that someone is going through depression. Life experiences. I mean, a number of things can explain. A number of things. Depending on what an individual could be going through. A number of things would actually explain the cause of depression. One, I also want to just add that depression is caused through a genetic composition. People who are born in families pre-exposed of depression are more likely to suffer depression at one point or the other in their life. And of course, the brain composition or the brain structure, if you want to look at it from the biological side, the brain structure will explain this, because then it's actually about the chemical imbalances in our brain that will cause actually this feeling of sadness and hopelessness. And that is the reason why medication as a way of treating depression is also encouraged. One of the key conditions that emerges from depression is, of course, mental illness. And an example of the mental illness as a result of depression, it could lead to psychosis, it could lead to schizophrenia. Those are, two main, related illnesses as a result of severe depression. For now, let's focus on those two, psychosis, because then as a result of not being able to manage that, it results to that. Schizophrenia is, of course, another mental illness that is characterized by a split kind of personality as a result of also depression. So those are two key main illnesses that would result from depression. It can lead to death. I mean, psychosis can lead to death. It can lead to paralysis. Okay, it can lead to disability, total malfunction of the human being, total malfunction of the human being. So, apart from just leading to death, it can cause paralysis, and of course, it can cause disability. One can injure themselves if they're not well taken care of. Okay, it can cause to severe injuries. It can cause one to actually commit offenses like murder as a result of lack of proper mental coordination. Okay, psychosis is a mental condition characterized by lack of mental coordination, where someone behaves like, in quotes, a mad person. Okay, this person is not well coordinated. Okay, this person, loses memory, loses the normal function. Those are some of the main, characteristics of psychosis.
Wajuao walisema kwamba jina jema hung'aa hata gizani.
Na vile wakasema bora ni bora iliyoboreshwa, na habari za TV47 zinazidi kuimarika kila kuchapo.
Tunasanzuka na kutamba ili kuhakikisha tunaweka bayana taarifa kemkem zenye usawa na mantiki.
Katika mida ya alasiri, kabla ya jua kutua, kutoka kaunti 001 na kupeperushia shina la upeo.
Na inapowadia saa 1 kamili,
nachukua usukani kukufahamisha
na kukupeperushia taarifa ipasavyo.
Tutakueleza ni kipi kilichojiri na wahusika ni wepi.
Ungana nasi
Depression can be treated in two main ways. One is what we refer to as psychotherapy, counseling. Other people refer to it as talk therapy, where a client or person suffering from depression actually visit a counseling psychologist, a clinical psychologist, and he or she is able to be taken through counseling to be able to identify the underlying reasons, the causes that perhaps has led to that person experiencing or struggling with depression. Now, this counselor will be able to support, this client through this process, and it takes time. It's a relationship that will be formed between the client and the therapist, a relationship that is aimed at ensuring that the client gets support and deals with the depression. Now, depending on the level of this depression, depending on how severe or mild this person is experiencing or struggle with this depression, this counseling psychologist may recommend that this person also needs to actually see a psychiatrist for a medical attention. And therefore that brings me to my second point, that depression can also be managed clinically. There's what referred to as clinical depression, which has to be managed clinically. And how do you do that? You do that through administration of drugs, and mainly the antidepressants. What are some of the examples of the antidepressant? Xanax is one of the common antidepressant that is given to people struggling with depression. The other one is what we refer to as Zoprac, which is also another very effective antidepressant. There are many antidepressants, and it's given after this person has actually also gone through different tests to establish or identify how suitable these drugs will be able to help this person. you're not just given any antidepressant because then you're struggling with depression. You have, the doctor has to ascertain, has to do other tests to establish perhaps the suitability of the drug that will actually best, support this person who is going through depression. So 2 main ways: psychotherapy, basically by counseling psychologists, and of course drug administration, basically done by the psychiatrist. So some of the risks involved on these drugs that actually help, people be able to deal or support people going through depression, may cause nausea, may cause weight gain as a result of increased appetite. Some people may lack sexual desire, okay, as a result of this drug. It may cause also fatigue, general body fatigue. It may cause dryness of the mouth, okay, most of the time you experience the dryness of the mouth. The other risk factor is that it may cause constipation. It may cause constipation to some of the clients who actually use these drugs. So a number of them, we have major depression, we have what we call persistent depressive disorder. We have another type we call bipolar disorder. We have another one we call psychotic depressive disorder. We actually have 4 main types of depression. So bipolar, major depression, persistent depression, and of course what I'm referring to as the psychotic or psychosis depression disorder. Major depression is basically characterized by extreme levels of sadness. Okay, because then we have said that depression is an emotional disorder, and therefore when you talk about major depression, we're talking about extreme, very high levels of emotional lowness, sadness. That would explain the major. Persistent is whereby over a period of time these characteristics do not go away. It keeps recurring, even after being attended to. After a while, this person still goes back to experience depression. Bipolar is whereby this client or this person going through depression experience 2 extreme ends, what we call manic episodes, where at some point you are either very elated, you're very happy, and at some point you are very, very low. And therefore it's an extreme type of a depression where you experience both ends, being so sad at some point, and of course at some other point being very, very, very elated. Psychosis is basically depression that leads to a mental illness that I talked about earlier on, the psychosis, where you lose coordination completely, you lose normal mental functioning, and that is what we refer to as the psychosis, depression related. First and foremost, be aware of the signs and symptoms of ill or rather mental health. And by being aware, it basically prepares you to be able to deal with this condition. So first, be aware. Number 2, take good care of yourself. Self-care, what counselors we keep on saying, self-care. So at all times, take good care of yourself. It basically also means that take time off normal routines or busy schedules that ideally will stress you more. Okay, eat well. There is great relationship between, of course, your diet and your mental health. And of course, one of the causes of depression is lack or insufficient of vitamin C, and therefore it's actually encouraged that you actually eat very well, so that then you're able to overcome or deal with some of this risk of getting depression. Keep a journal. Just write your experiences. Right, keep your journal, and you'll be able to monitor your progress, and you'll be able to know what is happening around you. That is equally very, very important. But of course, of the other importance, how do we improve or keep our mental health, is that seek professional care. Seek professional care. You can reach out to a counselor, you can reach out to a professional health caregiver, you can reach out to a spiritual leader who can be able to help you be able to deal with what you're going through. Exercise. Okay? Exercise has proved to be very effective in terms of just helping an individual vent or release the tension that ideally will cause stress and eventually cause depression. So have a habit, have a routine of doing exercises, and of course, as you exercise, then you're also keeping fit mentally and physically. Remember, we defined mental health as state of complete physical, mental, and social well-being. Have good social support networks. Belong to a group of people. You not necessarily need 100 people. You can just have 1 or 2 people who are your support system. It's important to belong. We are social human beings, and therefore it is important to belong. When you belong to a group, when you identify yourself with some people, then these people can be able to relate what you're going through, and in turn be able to support you whenever you experience any sign that is related to this topic of depression. Depressive people are very sensitive people to manage or take care of, but one of my advice to the family of anyone going through depression is that treat depression as a normal sickness. Treat it as a normal condition. When you do that, then you accept that one of your own is going through this. And it's unfair to label these people. It's unfair to discriminate these people. It is very, very unfair. And therefore, as a support system within a family setup or a social setup, it is important for us to accept that depression is real. Depression is normal. We are all candidates of depression, by the way, and therefore it does not make us any different when we are not experiencing depression and the other people are experiencing depression. And therefore, when you do that, then you'll be able to understand these people, you'll be able to support them in terms of what they need, in terms of just talking to them, in terms of just making sure that they're actually having their medication, in terms of just making sure that they're eating well, in terms of just making sure that they're exercising, and the environment around them is actually one conducive to enable them actually be able to deal with this depression and eventually recover. Okay, so my advice to the patient is that depression can be managed. It starts with the patient to actually accept that they're going through depression or they're struggling with depression. And when they accept that they're struggling with depression, then they can actually reach out to to professional caregivers or to other people around them who can be able to be of support to them. The other thing is that for those that are actually using drugs to manage depression, it is okay to actually observe the doctor's advice and what the prescription reads, and at the same time perhaps be able also to go through psychotherapy or counseling just to be able to deal with this condition we are referring to as depression. And therefore, it's not any different from any other conditions. And I like telling people that if you accept it, then you manage it better than just